Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us is Dr. Robert Popovian in Washington, D.C. He's a pharmacist, an economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me, as always, is my good friend, Ben Blanc, dialing in from the heartland of the United States, Indianapolis, Indiana, who is our Associate Director of Digital Production and Engagement. So Ben, it's election season. We're a month away from presidential election. So have you been keeping up with the debates and the campaigns on various issues and the various politicians?
Oh, you bet I have. It seems like every other conversation I have lately circles back to the elections, but how about you? I'm sure you've been looking into how healthcare will factor into both parties' programs, right?
Definitely looking into healthcare, definitely looking at specifically on drug policy issues and how politicians have been talking about drug pricing, spending, affordability, access for patients. It's always a hot button issue, healthcare is, and there's certainly going to be arguments made on both sides with regards to patient access.
And speaking of the intersection of healthcare and politics, today we're tackling a topic that's been bubbling under the surface. And the topic is how political affiliation doesn't always predict how well patients will be supported when it comes to healthcare policy. So let's get started. So, Robert, let's kick things off with the question at the heart of this episode. As you just mentioned, it's election season, and you've told me before that patients shouldn't rely solely on political affiliation to determine whether a politician or a group will support them in their healthcare matters. So, can you explain why it's more important to focus on actions rather than their party or political stance?
It's important because what we've seen recently is that, especially with regards to drug pricing issues, drug pricing, spending, affordability, access issues, and policies that surrounding them, that this topic is creating some strange bedfellows. We've seen very conservative congressional members partnering with very liberal congressional members, as well as agencies that are working for the current administration, the Biden administration, trying to fix what I think is the biggest issue in the drug pricing model, which is the pharmacy benefit management companies, and trying to shed some light about some of the activities that they're doing that are hurting patients, hurting employers, hurting the government, taxpayers. And it's created some strange bedfellows. On the opposite side, what we've seen, the same thing. There are individual organizations such as the Wall Street Journal editorial board who are agreeing with Governor Newsom that nothing should be done. In fact, that everything is fantastic, that PBMs are doing a great job. And we can talk about some of their actions specifically and some of the commentary that they've made that comes up for me with this conclusion. So for drug pricing policy, we have very strange bedfellows politically that are coming together, trying to help patients, and those that are coming together trying to hurt patients and reduce access.
Yeah, that's a really important point that you made there, Robert, especially when we see both sides taking different stances on healthcare. And now I just want to circle back to the Wall Street Journal. I know that you singled out a quote from the Wall Street Journal on LinkedIn recently. Okay, so I'm going to read that quote. If rebates are a problem, why does Congress require them for government plans? And I know that you've shared some strong opinions on this, so could you break down why is that statement misleading?
It's not only misleading, Ben, it's wrong. And we will be sharing the LinkedIn posts on this podcast. Congress doesn't require rebate contracting for PBMs to function. And as I stated in the LinkedIn post, and I've stated this multiple times on our podcast and when I've written pieces on drug pricing issues, the largest insurer in the largest state, California, largest insurer happens to be Kaiser, doesn't use rebate contracting, and they have one of the biggest managed Medicare programs in the country that they manage. And they don't use rebate contracting. Congress did not say you need to do rebate contracting. All Congress did, and CMS has done, is to rule that rebates are not a form of kickback, therefore it could be used as a form of contracting, but doesn't require it and doesn't prohibit the PBMs from doing any other type of contracting, which Kaiser does, which is net price contracting. So that's the thing that I think not only the editorial board was misleading, they were just wrong. And a simple look into what happened in the last administration with regards to the going back and forth during the Trump administration about whether rebates were kickbacks or not, they could have found out that rebates were considered not a kickback, and that's why they were allowed to happen, but not mandated by Congress.
Well, thanks for clearing that up, Robert. And now I'd like to shift gears and talk about Governor Newsom's recent veto of the PBM Reform Bill in California, the Pharmacy Benefit Manager Reform Bill in California. Why do you think this decision hurts patients, and what could have been different if the bill had passed?
So that's a great question. First of all, I want to mention that Governor Newsom has vetoed 3 separate bills that would have helped patients and would have sort of like fixed the problem with the pharmacy benefit management companies. The first bill was pre-COVID. It had to do with synchronization of prescriptions. It would have allowed pharmacists to synchronize prescriptions so patients, instead of having to go multiple times to the pharmacy, they could go one time a month. And the bill would have allowed partial payments of out-of-pocket costs for patients, because to synchronize, you only have to fill a few pills, to synchronize all the prescriptions at the same time. And it would have allowed partial payment for out-of-pocket costs, which the governor vetoed. So that happened pre-COVID. Post-COVID, there was legislation a couple of years ago that would have prohibited something we've discussed in our podcast last time around, which is steering patients to PBM-owned pharmacies. It would have prohibited that. He vetoed that one. And most recently, as you mentioned, this month or last month, he vetoed a bill that would have reformed PBM practices in California, and it would have allowed more transparency, better accountability, and also for patients to benefit from some of the concessions that pharma companies make to the PBMs. He vetoed it. So in 3 occasions, he's had a chance to help patients, and he's sided with PBMs. In 3 occasions, these bills had overwhelming bipartisan support, both in the House and the Senate in California, and he vetoed it all 3 times. This is a governor that is intentionally hurting patients. And this is difficult for me to say, but for a state like California that champions patients, consumers, and wants to protect them, a governor vetoing in 3 different occasions legislation that would have helped patients is really disturbing. And then to add to that, when you see states like Texas and Georgia passing similar bills, which are truly red of the red states that supposedly are not patient-friendly and don't care about consumers, passed legislation that really prohibit some of the bad activities that PBMs do, it is just mind-boggling to me how we've gotten to this point.
Yeah, it really sounds like that veto could have serious long-term consequences for patient care in California. Okay, so Robert, we just talked about Governor Newsom's, about California. So we were really talking about the state level. But how about the federal level? Let's look at that now. The FTC recently filed a lawsuit against the major PBMs on insulin pricing. How effective do you think this lawsuit will be in addressing some of the issues that we've discussed, whether it's high drug prices or limited patient choices?
So there's a couple of things to keep in mind. Number one, FTC filed lawsuit against the pharmacy benefit management companies after extensively looking at this issue, and not only the FTC, but also the Senate. They did the big insulin report a couple of years ago that came out. By looking at this topic, investigating for multiple years, they came to the conclusion that the behavior of the PBMs is really inflating insulin costs for patients or consumers in the United States. And that's why they filed the litigation. So they're looking backwards. Again, we're going to share these LinkedIn posts, both of them, for you all, the audience, to look at. It's astonishing to me that there are individuals, supposedly policy experts, who claim that the insulin issue has been fixed. So why is FTC filing a lawsuit? Well, FTC is not filing a lawsuit of what is happening today. What they're looking is backwards and the behavior of the PBMs over the decade long that has created a problem for patients in regards to affordability of a life-saving medicine. And therefore, it is so important for them to pursue this. What are the consequences? I think hopefully it will have some chilling effect on the PBMs about some of the practices that they've engaged in that has created this environment, such as excluding a authorized generic of an insulin and covering the brand name product because it's more profitable for them because they make more rebates and fees off of the brand drug. Now, having said that, you also have to know, Ben, you didn't mention it, but Express Scripts has filed a lawsuit against FTC regarding the report, and they filed it before FTC actually filed the lawsuit. So it's going to be interesting to see what happens. Does it have ramifications for the other drugs? Hopefully, but knowing this industry, the PBM industry, and the way they function, they really don't care. You can come after them with lawsuits and everything else, and all they do is basically try to fight the reality. And everybody knows the reality is, which is they're a problem in the healthcare system, and their existence creates difficulties for patients to accessing life-saving medicines. For FTCs to step in and do this, it's very important. But is it going to change behavior? I'm very skeptical.
Yeah, you explained it very well. There's definitely a lot happening in the regulatory space right now. Thank you so much, Robert, for sharing all these details with us. And you've said it, PBMs have had the same tactics for so many years. They've been pretty effective. They're going nowhere. We'll see how those lawsuits work out. But I think it's time to talk about patients. And that leads me to our million-dollar question, Robert. How can patients advocate for themselves in a system that's, you said it, is dominated by PBMs and insurers?
They have to, right, Ben? We've talked about this in our podcast multiple times. Patients need to become better consumers, better the ability for them to be able to understand and advocate for themselves. It's unfortunate to say this to a cancer patient who has more things to worry about than fighting the insurance company and fighting the PBM lobby. But the reality is that we're in a situation in the United States with everything that is going on, that the patients and the access to life-saving medicines are under attack by a single entity, and it's the pharmacy benefit management companies that now are either owned or own the insurance companies. So it's basically the insurance plus the pharmacy benefit management companies. And patients need to advocate for themselves, they need to be educated about it, and they need to demand for their rights. And depending on the state you live in, if you're fortunate enough, like you live in Texas, you will not be steered. You're prohibited from being steered to a PBM-owned pharmacy. If you live in California, unfortunately, Governor Newsom has decided that that is okay, that as a PBM, you can steer the patient to the PBM-owned pharmacy and not the independent pharmacies or other pharmacies that probably do a much better job in patient care.
Yeah, thanks, Robert. That's all very clear. And before we wrap up this episode, I really wanted to share 4 quick tips to help our listeners navigate health information on social media. And we all know it, with so much content out there, it's important to know how to spot reliable advice and avoid misinformation. So my very first tip would be on the lookout for who is sharing the information. So that means, check if the person posting has the right credentials, the right expertise. Then the second tip is ask yourself, is someone trying to sell me something? So watch out for posts that are linked to a product or a service. We all know it. Financial incentives can influence the information that's being shared, so proceed with caution. Another tip is you're going to want to make sure that the information is up to date. I mean, Robert, we just talked about it. There's a lot that's happening in the regulatory space. There's always going to be updates to your health insurance plan. There's always going to be something to be on the lookout for. So just ensure the information that you're seeing is the most current. And one last suggestion, always cross-check the facts. So always compare what you've read with other trusted sources. And so, Robert, my take on all this is that political affiliation doesn't always dictate healthcare policies. Instead, it's the actions that politicians and regulators take that determine whether patients will benefit or suffer from programs and regulations. So understanding the role of PBMs and political decisions like Governor Newsom's veto is crucial for patients. And you know what? It all comes down to staying informed, looking beyond the labels, and doing your own research, especially here in the US. But But Robert, you're the expert, so you have the last word.
I couldn't have said it better, Ben. I think you said it perfectly. Number one, check the sources, who you're getting it from. If your information is coming from the City of Hope, like if you're a cancer patient, if it's coming from the Mayo Clinic or Sloan Kettering, those are trusted sources. If it's coming from your Uncle Jim on the Facebook, probably not so much. So number one, the sources do matter. Then number two is that you're absolutely right. Drug policy, especially in healthcare, has created some strange bedfellows where we have conservatives and progressives in Congress teaming up with FTC to really shed light to some of the PBM practices, while you have people like the editorial board of the Wall Street Journal, certain conservative groups, and Governor Newsom trying to protect the corrupt PBM model. And so for patients, they need to just do some due diligence with regards to getting the information that they're getting. But more importantly, unlike other issues that we have in politics, this is not 100% politically aligned issue, that they need to do their due diligence of where those politicians stand if pharmaceutical access is a very important issue for them, which I think for most patients are, because it gives them hope and longevity and better life.
Well, thanks for breaking that down for us, Robert. I think that was some very valuable information for our listeners. And that's it for this episode, so don't forget to subscribe to our podcast on Apple Podcasts, Spotify, or wherever you might be listening so you never miss an episode. And if you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your family and friends. It'll help more people like you find us.
If you have any questions, as always, please send it to us. We want to hear your suggestions, thoughts, comments. And, we usually come up with these podcast topics based on audience feedback. Please email us at podcasts@ghlf.org. And, hopefully we'll use that topic for a future podcast that we're going to be recording.
And before you go, make sure you take a listen to some of our other great podcasts on the GHLF Podcast Network. You can find all of GHLF's podcasts at ghlf.org/listen. He's Dr. Robert Popovian.
And he's Ben Blanc, and we'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.